opioid crisis has been front and center over the past few years. Drug addiction is a difficult subject, but continues to impact families across central Illinois.
That's right. I sat down with an expert, Dr. Susan Mantell, who's devoted part of her life and career to helping individuals with addiction recovery. It's an issue that affects more people than you might realize. Let's take a look. Addiction is a difficult topic, but it affects people from all walks of life. I got to sit down with Dr. Susan Mantell. In addition to her family practice, Dr. Mantell is a board-certified addiction medicine physician. I met with her at the Champaign Office of Recovery Concepts, an outpatient opioid treatment program where she provides medical services for addiction recovery patients.
So we are a medication-assisted treatment program. So there are several different kinds of medication-assisted treatment. Suboxone is one that people know a lot about. But what I specifically work with is methadone. So methadone is a narcotic. It is replacing the short-acting, more addictive narcotics such as heroin and fentanyl with a different narcotic that is controlled, so it's safe. It's something that we can actually put people on, they can get their lives back together, and then we can slowly taper them off. It's amazing even to look at the pictures of people when they first come in and then maybe a year later, or when
What's the difference that you see? What do you notice?
Gosh, just their overall appearance of their skin and their energy that they exude.
What has been the biggest surprise for you personally in this specific area of work that you're doing?
So originally the surprise was that addiction affects everybody. So, you know, you kind of even, I spent 10 years working in the emergency room, and even my colleagues, you know, they had this kind of skewed view of what addiction was. And then when you meet people and you start talking to people, and then you have people that are stay-at-home moms that their spouse doesn't even know they're addicted to heroin. You have people that are, you know, legislators, family members, lobbyists. You know, over in Springfield, we would have people that, you know, were involved in politics, for instance. You have people that are very poor, people that are very rich. It doesn't discriminate. It doesn't matter what color your skin is, where you came from. You know, addiction it's complex, but it's also simple in the way that it affects everybody. When I started, you know, evaluating patients to start on methadone and started asking them how they became addicted and hearing the stories, it was one after another. It was, you know, got my wisdom teeth out, got prescribed Tylenol with codeine. I found that it made me feel better and more energetic, or, you know, Vicodin is a really common one, or technically hydrocodone because there's multiple versions of it. And so hearing those stories over and over again and realizing that patients didn't come by addiction because they decided one day to go out and try heroin. It was they started out on a pain medicine, and then they became tolerant and they kept needing more, and then they would have to find another solution, because what happened in, you know, the early to mid 2000s is doctors started, you know, stopping prescribing so much. And then when we get into the late 2000s, you know, 2020, 2018, that kind of time frame, we started seeing, you know, the massive opioid overdoses. So a lot of doctors just cold turkey stopped their patients.
But then that probably created a secondary issue where you had a whole group of addicted people, and they could no longer fill that need.
Absolutely.
What would you tell somebody who is currently struggling with addiction but has not reached out for help?
Definitely reach out for help. There are lots of different ways to treat addiction, and, you know, living this terrible cycle of having to chase drugs and find drugs, and then just the chance of getting something like fentanyl or one of the other, you know, mixtures that we see put into these illicit drugs. You know, get help, because the last thing you want is a family member to find you, you know, having overdosed, or your children to find you. I think that's the part that kind of keeps you going, knowing that if you can change one person's life, then that may lead to another person's life change.
Dr. Mantell and her colleagues at Recovery Concepts offer both hope and help to those that are struggling with the issue of addiction. They specifically focus on helping individuals recover from opioid dependence through methadone, Suboxone, and counseling.
If you or a family member are in need of assistance, you can visit the Recovery Concepts website. We'll have their information available for you over on our website, CILiving.tv.